Good afternoon. Namaste to all our viewers. Uh, this is Dr. Aparna. I am your emotional healing synergist. I am an Ayurvedic psychotherapist, a passionate infopreneur, edupreneur, and medical writer. In my pursuit of addressing, promoting, and propagating Ayurveda and psychotherapy globally, I take up different topics every week and explain it in detail. So, our today's topic of discussion is OCD. I know a lot of you might have heard about the word OCD. So, OCD is obsessive compulsive disorder. But most of you might not have known what exactly is OCD and what happens in OCD. What are the causes of OCD? What are the types of OCD? And how to manage OCD? OCD is in itself a vast subject. So, so I have divided the OCD session into maybe two or three sessions. Today is the first session on OCD. So let's get started. So what is OCD? As you all know, obsessive compulsive disorder. And what is normalcy, and what is OCD? Because there are different myths on what is OCD and what is not. So that also needs to be addressed, because people think that some normal instances can also be they correlate it to OCD, and it is commonly told that I have OCD, I have OCD, but few things are not OCD. So let's discuss what is it. So See, OCD stands for obsessive compulsive disorder. What is it? It is a mental health condition characterized by two main components. What are the two components? One is obsession, two is compulsion. So, people with OCD experience intrusive and distressing thoughts, images, or impulses. So, they might experience some distressing thoughts or images or impulses that are called triggers. So these are obsessions, and for that obsessions that leads to repetitive behaviors or mental acts performed in response to those obsessions. There are the responses to it, response behaviors are called as compulsion. So I'll explain it, what is obsession and what is compulsion. So what, to alleviate the anxiety, for the temporary relief, what we do is that obsessions lead to some compulsions. So the cycle of obsessions and compulsions, what happens is, over a period of time, can become overwhelming and interfere with daily life. Okay, obsessive compulsive disorder is a common chronic is, it is long lasting, and it is long lasting disorder in which a person has uncontrollable recurring thoughts, that is obsessions, and for that he has some compulsions, some behaviors, those are called compulsions, or that he or she feels the urge to repeat it over and over and over again. So, people with OCD may have symptoms of obsessions, compulsions, or both. Few people may have only obsession, few people might experience both obsessions and compulsions, and the severity and the intensity also differs from person to person. So, what happens is, these symptoms can interfere with all aspects of life, such as work. It can interfere in your work, it can interfere in your school, and it can interfere even in your personal relationships. So, types of OCD here in brief include fear of contamination. See, germophobia here, this is very common. Fear of contamination, compulsive checking for completion, and if you have either whether you have locked the door or not, whether you have switched off the gas or not. Here there is a difference between normalcy and OCD. All of us also experience these. At times we have thoughts such as, अरे मैंने गैस ऑफ किया है कि नहीं किया है, अरे मैंने गीजर बंद किया है कि नहीं किया है, अरे मैंने डोर का की डाला है कि नहीं डाला है. दिस इज नॉट OCD, दिस इज नॉर्मल. All of us have. But if it interferes in your daily life, that will know it later in the session itself. So fear of harming others, ordering and arranging objects in a specific way, specific ways, उनको चीजें ऐसे ही रखी हुई चाहिए, सिम्टोमेटिकली, जो सिस्टमिकली जो ऐसे ही होता है ऐसे ही चाहिए. Arranging your wardrobe is different. Spending your 70 to 80% of the time arranging your wardrobe every day is different. So that is the difference between normalcy and OCD. And these behaviors can become aggressive sometimes and violent as well. Or also they might have some sexual thoughts as well. This is also a type of OCD. So, obsessions. So, when it comes to obsessive compulsive, so what is obsession? These are intrusive and persistent thoughts, urges, or mental images that are typically unwanted and cause significant distress. So, examples of common obsessions are, so common obsessions किसे कहते हैं? Obsessions are, see, contamination fears, as I said. So, a person might constantly fear germs or dirt and feel compelled to wash their hands excessively to avoid contamination. There is a trigger in a person's brain that there are germs everywhere, here, there, on the tap, in the sink, down the floor, in my in the clothes I am wearing. This is excessive thought. We all are, we all are compelled to wash our hands once in a while when the hands get dirty, or we that's something unhygienic. But here it is constant fear of germs, that is unwanted fear. It is not real, it is only in the mind. And feel compelled to wash their hands excessively to avoid contamination. मतलब if a person washes 4 to 5 times a day, his or her hands, these people wash up to 30 to 40 times. This is not normal. And next, harm related obsession. So fearful thoughts, second type is fearful thoughts of causing harm to oneself or others. Oh, I can cut my hands if I use the knife, leading to repetitive checking behaviors, repetitive checking of whether you have switched off the gas, whether you have kept the knife in the place, whether you have locked the door, whether you have switched off the geyser. All these types and many different infinite examples can be given for this, such as repeatedly ensuring the stove is turned off or the doors are locked. These are common, very common. And symmetry and order, this is also an obsession. A person may have an overwhelming need for things to be perfect order. See, on the dining table, the spoons, the glasses, the plates are arranged always. The person makes sure that everything is kept in a perfect way, in a symmetric way, or in a balanced way. So leading to excessive arranging or in the wardrobe or the house or the things. So excessive arranging or excessive organizing of objects, this is much more than normal people also do arranging, normal people also do organizing, but this is extreme levels. And what are compulsions? So these are the obsession that there are germs. So compulsions are the repetitive behaviors. If you have a obsession that there are germs everywhere, then the compulsion would be you will wash your hands 30 to 40 times a day, or repeatedly you're going to wash your hands with soap, or repeatedly you're going to take bath, or repeatedly you're going to clean the house, All these are called compulsions. For the trigger of thoughts, obsessions, you have compulsive behaviors which are called compulsions. So what are the examples? So these are repetitive behaviors or mental acts that individuals with OCD engage in to neutralize or to reduce the distress. Why they do it is for temporary relief. When they have to experience, see, when they have the consistent obsessions, they want temporary relief, or they experience anxiety, and they want to reduce or neutralize the distress caused by that obsession, so they indulge in the compulsive behaviors. So that is called compulsion. And what is it? So checking rituals, because you feel that it may harm others or harm you, you repeatedly checking that the doors are locked, appliances are turned off, and nothing terrible has happened. Once or twice everybody checks, but repeated checking, why you do is, when normal people check, in normal conditions, when people check, they have, registered that, okay, I have locked the door, okay, I have switched off the gas. But these people don't register that, and they have constant fear that I have not done this correctly, I have not locked this, I have not switched it off. They have consistent, consistent fear, consistent anxiety. So they do it repeatedly. Cleaning rituals, engaging in excessive cleaning or washing to alleviate contamination fears, and counting or repeating. So, some individuals may count to a specific number or repeat certain words or phrases in their mind to reduce anxiety. They might count and repeat frequently. This is less common, but this is also a type of, compulsive behavior in OCD. So it's important to note that while many people may experience mild obsessive or compulsive tendencies at times, okay, a diagnosis of OCD is made when these symptoms significantly impact a person's daily functioning and cause significant distress or impairment. See, if you ask me, how do you know that it is a disorder or a normalcy? The blind formula is, if anything that you do, is interfering or intruding or, harming your daily routine or daily life, then it is a disorder. Okay, so OCD can be quite distressing for those who experience it, as they may recognize that their obsessions and compulsions are irrational. They will also sometimes, have that, they know that their thoughts and their feelings at times are irrational, but they find it difficult and challenging to control or stop them. So the disorder can interfere with relationships, work, and general quality of life. When it is interfering into the quality of your life in daily routine, then that is a problem. So if someone suspects that they have OCD or knows someone who does, it's essential to seek professional help from mental health experts who can provide appropriate assessment and treatment. See, and so let's know. If you ask me how to recognize what is the full cycle of OCD, ये कैसे होता है OCD, मतलब obsession कैसे होता है, anxiety कैसे होता है, और compulsion कैसे होता है. If you want to know the full cycle of it, so let's go through the cycle step by step with, you know two case studies here. See, one is, first thing is, what I'm talking about is contamination OCD. So contamination OCD will take the example of Peacock here. Peacock is a client, and Peacock experiences contamination OCD. So what is it? Peacock has OCD with contamination fears. Peacock, every time Peacock fears of germs and getting infected, and he has contamination fears. He becomes obsessed with the idea that he will contract a serious illness if he touches any public surfaces or objects that others might have touched. So he becomes obsessed with the idea that he will contract. Sometimes what happens is, how this triggers is, maybe in childhood peacock might have seen actually some person getting infected or getting germs, or being hospitalized for touching public surfaces or contacting infection. So it might be the past experience or the childhood experience, because the OCD can be you know developed since childhood. So what happens is, this is the obsession. So what it does is, obsessions leads to anxiety. So this is an obsession. The obsession is a thought. This is a thought in his mind. What it does, that thought leads to anxiety. So what happens in anxiety? So the obsession triggers intense anxiety and distress in peacock. So this obsession triggers intense anxiety. We can't explain it in words. It will be experienced only by the people having OCD. So what happens is, he becomes overwhelmed with the fear of getting sick and the potential consequences. In his mind, he captures the images and pictures and imagine that he will be getting sick, and he will have to face the potential consequences. Either he has visualization or thoughts or images of this, and it may have uh, that may have an impact on his health and the health on his and health of his loved ones. So this way, the obsession triggers intense anxiety and distress. So this thought leads to distress. So next, what happens is compulsion. So in an attempt to reduce his anxiety, now he is anxious. He has to get a temporary relief. He has to reduce his anxiety and distress. What a peacock does is, peacock engages in various compulsive behaviors. These include avoiding touching doorknobs, handrails, or objects in public places. So he avoids touching doorknobs, handrails, or other objects in public places. He also washes his hands excessively. He bathes excessively. He often uses harmful and harsh chemicals and scrubs for minutes at a time. And इनका ना जो हैंड वॉशिंग और वॉशिंग होता है, नॉर्मल नहीं होता जैसे हम करते हैं. They use harsher chemicals, and or what they do is, they use hand wash for 10 minutes. They constantly rub it, they constantly do it, and repeatedly use hand washes. आप सोचिए कि क्या होती होगी उसकी हालत उसके बाद. What might happen after, if you wash your hands continuously for 5 to 6 minutes in with frequently 25 to 30 times a day. See, you think of what will happen to that person. So, and after this compulsion, no, after washing of hands, he feels a sense of relief. Oh, okay, now I'm not going to contract any germs. That too for a limited amount of time. This compulsive hand washing and avoidance of contaminated objects temporarily relieves, Peacock's anxiety. So he feels a sense of safety and cleanliness after washing his hands and by avoiding the feared objects. He believes he is minimizing the risk of getting sick. So what this happens is, this fixes a core belief that what he is doing is good, and it is minimizing the risk of getting sick. So this happens, so it gives a temporary relief. Then ultimately what happens? Reinforcement of obsession. Okay, this is giving me relief, and I am gonna repeat it again and again and again, over and over. This happens. So, although the compulsions provide temporary relief, they enforce the underlying obsession. So Peacock's brain learns that engaging in these behaviors reduces anxiety. For him, for a temporary time, the anxiety is reduced, reinforcing the belief that his fears are justified. His fears are justified. His fears are totally irrational, but he feels that his fears are justified, and strengthening the connection between the obsession and the compulsion. And what happens is this strengthens the connection between the obsession and compulsion. What happens is ये पक्का हो जाता है उसके माइंड में कि what is happening is, right, what I am doing is right. For this obsession next time से मैं यही करूंगा. अगर मुझे डर लगे तो मैं हाथ धो के आऊंगा, नहा के आऊंगा, क्लीन कर दूंगा पूरा. This is the obsession. एंड द ऑब्सेशन रिटर्न्स. ये एक साइकिल नहीं है. अगर ये एक ही साइकिल होता, अगर ये दिन में एक ही बार होता तो कोई प्रॉब्लम नहीं है. लेकिन ओवर टाइम द रिलीफ फ्रॉम कंपल्शंस डिमिनिशेस एंड द एंजाइटी एसोसिएटेड विथ द ऑब्सेशन रिटर्न्स. द सी द रिलीफ फ्रॉम द कंपल्शन डिमिनिशेस. उसके बाद क्या होता है? द एंजाइटी एसोसिएटेड विथ द ऑब्सेशन रिटर्न्स. So क्या करता है पीकॉक? पीकॉक में also begin to doubt whether he washed his hands properly. Wash करके आता है hands, then he is like, I have washed my hands properly or not, I don't even know. Then he'll go again, he'll wash his hands. Again he'll come back, again he'll have thoughts that he's not washed his hands properly for enough amount of time. Then again he'll go, he'll wash his hands and come. Then again he'll come 5 minutes, he'll be fine, he'll go bathe and come. Next. So, leading him to repeat the washing ritual multiple times. So, this cycle is a vicious loop, with Peacock's contamination fears intensifying, leading to more frequent and time consuming compulsions. This OCD cycle hinders Peacock's ability to lead a normal life, as he may avoid. So what happens is, in turn, he may avoid public places. He experiences difficulty at work or school because he is not able to concentrate and focus on the work itself, on the school itself. He is not he is always thinking of the germs, going, washing hands, bathing, cleaning, and all his daily routine is impaired. So he faces strain in the public, personal relationships as well, in social and personal relationships. So he cannot give time to his family, he cannot give time to his work and social groups. So what happens is, not only his work, his personal relationships and personal life is also hampered. So this is a complete cycle of OCD. We'll know with another example. This, what I said, is contamination OCD. The second case study I'm going to talk about is checking OCD. So for this, the obsession is, now here it is, this is a cat. So cat or kitten experiences checking OCD. So what happens here? She becomes obsessed with the idea that she left her stove on and it will cause a fire that could harm her and her family. So, Cat here becomes obsessed with the idea that she has left her stove on and it will cause a fire. This is an unnecessary, irrational thought in the mind and could harm her and her family. So, what happens because of that obsession or the thought? There arises the anxiety. The obsession triggers intense anxiety and fear in Jane. She experiences, intense anxiety and fear. Cat experiences intense anxiety and fear. What happens? The thought of her home catching fire and endangering her loved ones becomes all consuming. For her inner mind, it creates distress. If only that is running in her mind. Oh, I didn't switch off the gas, I didn't switch off the gas, I didn't see if the door is locked or not. Oh my god, it will catch fire, thieves will come and stole the things. So she is not focused and concentrated on her work because of the anxiety and fear. Next, what happens is the compulsion. So to alleviate her anxiety, Cat performs checking compulsions. What she does, she repeatedly returns home to verify whether the stove is turned off. She repeatedly returns home and she checks whether the stove is turned off, or whether the door is properly locked or not. Even after she initially checked it before leaving, she has checked it before she left. Actually, she knows that she has checked it, but she has to do it again because she has a doubt whether she has properly turned it off or not, she has properly locked it or not. This is irrational thinking. This causes irrational behavior. And then what happens? This gives her temporary relief. Okay, I have switched off the gas. But repeated checking gives her temporary relief. So upon checking the stove multiple, times and confirming that it is off, Cat experiences temporary relief from her anxiety. So she feels reassured that her family is safe from potential harm. So she experiences, temporary relief. That and of this, because of this temporary relief, there is reinforcement of obsession. So that means she वो पक्का अपने थॉट को पक्का कर लेती है कि the temporary relief from compulsions reinforces cat's belief that checking the stove is necessary repeatedly to prevent disaster. ये उसके मन में पक्का हो जाता है कि मुझे बार बार जाके चेक करना ही पड़ेगा, क्योंकि ये क्या कर रहा है, मुझे एक रिलीफ दे रहा है और ये डिजास्टर को भी प्रिवेंट कर रहा है. Her brain associates the act of checking with safety. वो ये चेक करना सेफ्टी, एक सेफ्टी मेजर है करके वो करना शुरू कर देती है. So further strengthening the connection between the obsession and the compulsion. That strengthens the connection between the obsession and the compulsion. So what happens is this core belief is registered now in her mind. So anytime she experiences fear and anxiety, she repeatedly runs to check and checks and comes. And what happens? The obsession returns. What happens? Despite repeated checking, doubts and intrusive thoughts return. Even after, when she checks and comes, after 5 minutes the relief is gone. Again the obsession is increased. Again she goes. Intrusive doubts and intrusive thoughts return. And Cat begins to worry that she may have overlooked something during her previous checks. So she might have overlooked something. Maybe she has not turned it off properly. Leads her to continue the checking rituals, which can go on for extended periods. This will go on for extended periods till she does not check for about 15 to 20 times. She does it repeatedly. And over a period of time, what happens is this becomes a habit. This cycle can be distressing and time consuming, making it difficult for cat to leave her home without worrying about potential hazards. This becomes distressing, and she cannot leave her house itself now, because as soon as she leaves her house she feels there is something going to be wrong, and she may spend hours each day checking various appliances and doors, leading to exhaustion and interference with her daily functioning. What happens? She cannot focus and concentrate on her job, on her work, on her other household chores, on her profession, on her school, on the social gatherings. Everything is affected. So it is interfering with her daily functioning. So, in both case studies, the individuals are trapped in a cycle of obsession. What happens is an individual gets trapped in a cycle of obsession. Then what happens? Anxiety. And what happens? Compulsive behaviors, which significantly affects their quality of life. It's essential, even at in a point of time they'll realize that, okay, my fears may be irrational. What happens is it is very challenging for them to come out of that, because that has become a core belief now. So that belief has strengthened. So what happens is, which significantly affects their quality of life. It's essential for individuals experiencing OCD to seek professional help to break the cycle and receive appropriate treatment to manage their symptoms effectively. So this is the thing. And if you ask me what is normalcy and what is OCD, you might ask कि इसमें कुछ तो हम भी करते हैं, मैं भी तो चेक करती हूँ गैस ऑन है कि नहीं ऑन है, मैंने स्विच ऑफ किया है कि नहीं, डोर लॉक किया है कि नहीं किया है, और हाथ तो मैं भी धोती हूँ. तो व्हाट इज नॉर्मलसी एंड व्हाट इज ओसीडी, विल डिस्कस इट इन डिफरेंट सिनेरियोज कि नॉर्मल पर्सन क्या करता है और ओसीडी का पर्सन क्या करता है, व्हाट इज द डिफरेंस. See, distinguishing between normalcy and OCD involves recognizing the presence of persistent and distressing obsessions and compulsions. The thing is, in a normal person, what happens is he might or she might check it for once or twice maximum. But here it is persistent and distressing obsession and compulsion that significantly interferes in daily life. And it is essential to consider the frequency. कितने बार आप रिपीट कर रहे हो, what is the intensity and what is the impact, उससे क्या impact हो रहा है आपके लाइफ में. So ये सब you have to, there are some key points which will help to differential diagnosis of OCD. सो फ्रीक्वेंसी एंड ड्यूरेशन. नॉर्मल में क्या होता है, मोस्ट पीपल एक्सपीरियंस ओकेशनल और अनवांटेड थॉट्स और एंगेज्ड इन रिपीटेटिव बिहेवियर्स. However, these thoughts and behaviors are usually infrequent and short lived. See, this thought, sometimes what happens is आपका ध्यान नहीं रहता है कि आपने गैस ऑफ किया है कि नहीं किया है, और डोर लॉक किया है कि नहीं किया है, गीजर बंद किया है कि नहीं किया है. वो तब आप क्या करते हो कि जाके एक बार चेक कर लेते हो कि आपने किया है कि बंद नहीं किया है, वेदर यू हैव डन इट और नॉट. एक बार चेक कर लेते हो, और ये थॉट आपके मन में बार बार नहीं आता. जब आपका ध्यान और फोकस उस पर होता है ना, तब आपको ये नहीं आता. दैट इज नॉर्मल. क्योंकि ध्यान नहीं रहता तो फिर आपको जाके एक और बार चेक करना पड़ता है. वो ओसीडी नहीं है. लेकिन ओसीडी में क्या होता है, इंडिविजुअल्स विद ओसीडी एक्सपीरियंस ऑब्सेशंस एंड कंपल्शन ऑन अ रेगुलर बेसिस, ऑफन डेली, एंड द सिम्टम्स कैन लास्ट फॉर अ सिग्निफिकेंट पीरियड ईच डे. और ये सिम्टम्स जो है सिग्निफिकेंट पीरियड के लिए रह सकता है, या फिर पूरे दिन के लिए ये सिम्टम्स रह सकता है. ये वॉश करने का, ये क्लीन करने का, ये बार बार जाके चेक करने का, ये इसका ना फ्रीक्वेंसी, इंटेंसिटी और इम्पैक्ट बहुत गहरा है. सो उसको ओसीडी कहते हैं. एंड इन डिस्ट्रेस एंड इम्पेयरमेंट, सो फ्रीक्वेंसी एंड ड्यूरेशन हो गया. सो इन डिस्ट्रेस एंड इम्पेयरमेंट व्हाट हैपेंस इज, नॉर्मल में क्या होता है, occasional unwanted thoughts or behaviors may be momentarily distressing but do not lead to significant impairment in daily functioning. अगर आप चेक करें, एक बार गैस को चेक करके आए, मतलब सेकेंड बार आप डबल चेक कर रहे हो, या फिर डोर को आप डबल चेक कर रहे हो, या फिर हाथ भी एक और बार आप धो रहे हो, ये करने से आपका डेली रूटीन हैम्पर नहीं होता है. नॉर्मल इंडिविजुअल्स में आपका सिर्फ 1-2 मिनट वेस्ट होगा, और फिर आप अपना काम, डेली का काम जैसे कर रहे थे आप कंटिन्यू करेंगे, फोकस करेंगे और कंसंट्रेशन रहेगा. क्योंकि ये अनवांटेड थॉट्स जो है ये मोमेंटरी है. लेकिन इन ओसीडी इट कॉजेस सिग्निफिकेंट डिस्ट्रेस एंड एंजाइटी, एंड द कंपल्सिव बिहेवियर्स आर ऑफन परफॉर्म्ड टू अलिविएट दिस डिस्ट्रेस. The obsessions and compulsions can interfere with work, school, relationship, and other important aspects of life. ये होता है नॉर्मल और ओसीडी में डिफरेंस. एंड उसमें भी रैशनैलिटी ऑफ थॉट्स एंड बिहेवियर्स. सो नॉर्मल पीपल में क्या होता है, people may recognize their unwanted thoughts or behaviors are as irrational or exaggerated, and they can easily dismiss or ignore them. See, normal people में क्या होता है ना, एक दो बार ऐसे होता है नॉर्मल कंडीशंस में कि आप चेक कर रहे हो, डोर गैस चेक कर रहे हो, डोर चेक कर रहे हो, गीजर चेक कर रहे हो, एक दो बार ऐसे होता है. फिर बाद में आपको ही लगता है कि मैं अननेसेसरीली घबरा रही हूँ या घबरा रहा हूँ. ये अननेसेसरीली मैं इसको एग्जैजरेट कर रहा हूँ, छोटी सी चीज को मैं बड़ा कर रहा हूँ या कर रही हूँ। सो वो क्या करते हैं, इसको इजीली गिव अप कर देते हैं, क्योंकि इनके माइंड में कोर बिलीफ नहीं बना हुआ होता है। ये तो सिर्फ जस्ट थॉट्स है जो कभी कभी मोमेंटरीली आते हैं। तो क्या है, इसको डिसमिस कर देते हैं नॉर्मल पीपल, एंड दे कैन इजीली डिसमिस और इग्नोर देम इन नॉर्मल कंडीशंस। इन ओसीडी पीपल क्या होता है, individuals with OCD may recognize that their obsessions and compulsions are irrational, but they find it challenging to control or stop them. Even though जब उनको पता भी चल जाए कि अननेसेसरीली तू एक्स्ट्रा घबरा रही हो, यू आर एग्जैजरेटिंग इट, तुम उसको छोटे चीज को बड़ा कर रहे हो, तब भी वो लोग उसको नहीं रोक पाते, क्योंकि अगेन उनका कोर बिलीफ, उनका जो सोच है ना वो पक्का हो चुका है। जो ऑब्सेशन और कंपल्शन का कनेक्शन है ना वो स्ट्रांग हो चुका है। और ट्रीटमेंट में हम यही करते हैं कि ऑब्सेशन और कंपल्शन के कनेक्शन को हम तोड़ते हैं, वी डिस्कनेक्ट इट, and interference with life. So what happens is, how does it interfere with life? So normal condition में unwanted thoughts or occasional repetitive behaviors do not interfere with person's ability to carry out their daily activities or relationships. Normal conditions में ये आपकी जिंदगी के डेली रूटीन में या रिलेशनशिप्स में कोई फर्क नहीं पड़ेगा उतना ज्यादा। लेकिन ओसीडी में क्या है, ये टाइम कंज्यूमिंग हो जाता है। ओसीडी कैन बी टाइम कंज्यूमिंग, कॉजिंग सिग्निफिकेंट इंटरफियरेंस विथ वर्क, सोशल लाइफ एंड पर्सनल रिलेशनशिप। इट मे लीड टू अवॉइडेंस ऑफ सर्टेन सिचुएशंस और प्लेसेस, ये होता है। So inability to control, so it becomes very difficult to control. So normal people में क्या होता है, people without OCD can typically control and dismiss unwanted thoughts or behaviors without too much difficulty. उनको उतना difficulty महसूस नहीं होता है, वो उनको dismiss कर देते हैं या ignore कर देते हैं। एक बार दो बार करते हैं, फिर वो dismiss कर देते हैं उसको कि मैं ऐसे घबरा रहा हूँ ज्यादा और घबरा रही हूँ। या ये ओसीडी में क्या होता है, इंडिविजुअल्स विद ओसीडी फाइंड इट डिफिकल्ट टू कंट्रोल देयर ऑब्सेसिव थॉट्स एंड अर्ज टू एंगेज इन कंपल्सिव बिहेवियर्स। इनको बहुत मुश्किल फील होता है, चैलेंजिंग फील होता है, इवन दो उनको पता चले तो भी उनका वो हल नहीं ढूंढ सकते। सो क्या करते हैं, दे ट्राई टू रेसिस्ट द कंपल्शंस ऑफन। कभी कभी क्या करते हैं, दे ट्राई टू रेसिस्ट द कंपल्शन, तब क्या होता है, एंजाइटी ज्यादा हो जाता है और दो प्रॉब्लम बढ़ जाता है। रुकने क्या बजाय वो प्रॉब्लम बढ़ जाता है, फिर प्रॉब्लम इंक्रीजेस। दे ट्राई टू रेसिस्ट द कंपल्शंस, ऑफन लीड्स टू द इंक्रीज्ड एंजाइटी। सो थीम्स एंड पैटर्न्स, सो नॉर्मल पीपल में कैसे होता है और ओसीडी में कैसे होता है। So normalcy में unwanted thoughts and behaviors in normal individuals are diverse and not confined to specific themes or patterns. ये क्या होता है, यूजुअली नॉर्मल पीपल में हमें तरह तरह के सोच, सर्कमस्टेंसेस के हिसाब से तरह तरह के सोच आते हैं, मतलब एक ही नहीं होता। वो कंटामिनेशन का फियर हमेशा नहीं होता, एक बार कंटामिनेशन का हो सकता है, एक बार चेकिंग का हो सकता है, एक बार कुछ और ही हो सकता है। ये क्या होता है, नॉर्मल सी में क्या होता है, एक स्पेसिफिक पैटर्न नहीं होता, एक स्पेसिफिक थीम नहीं होता कि इसी वजह से उनको ओसीडी होता है कि उनको रिपीटेटिव बिहेवियर्स होते हैं करके। लेकिन ओसीडी में क्या है, एक स्पेसिफिक पैटर्न होता है, एक स्पेसिफिक थीम होता है। अगर कंटामिनेशन फियर है तो कंटामिनेशन फियर का ही होता है, अगर अरेंजिंग का फियर है तो अरेंजिंग का ही होता है, वार्डरोब अरेंज करना, डाइनिंग टेबल पे अरेंज करना। अगर वो चेकिंग फियर होता है तो चेकिंग फियर ही होता है। देयर इज OCD is characterized by specific themes such as contamination, checking, symmetry, harm related thoughts, etc. एक पैटर्न होता है OCD में। OCD has a pattern and a specific theme. So the obsessions and compulsions are often consistent and revolve around these themes. So obsessions and compulsions are consistent and they revolve around these themes. So impact on insight, insight पे impact कैसे होता है, नॉर्मल पीपल में, पीपल विदाउट ओसीडी यूजुअली मेंटेन गुड इंसाइट इनटू द इरेशनैलिटी ऑफ देयर अनवांटेड थॉट्स एंड बिहेवियर्स। मतलब नॉर्मल सी में क्या होता है, यूजुअली उनको पता चल जाता है कि एक दो बार करने के बाद ये फालतू का मैं डर रहा हूँ या डर रही हूँ, या फालतू का मेरे अंदर ये थॉट आ रहा है, ये इसको डिसमिस ही कर देना चाहिए। लेकिन इसमें जैसे मैंने पहले भी बोला है कि इवन दो इफ दे, एक तो उनको रिकॉग्नाइज नहीं होता है, दे कोरिलेट इट टू सेफ्टी, they correlate it to being without infection, or they correlate it with something। एक तो उनको recognize होने के बाद भी, despite recognizing the irrationality, individuals with OCD have difficulty breaking free from the cycle। वो cycle of obsession and compulsion से बाहर ही नहीं आ पाते, due to the anxiety associated with the disorder। ड्यू टू द एंग्जाइटी एंड द फियर, घबराहट है उनको, और उनको बहुत एंग्शियस महसूस करते हैं और बहुत घबराहट है उनको। सो तब क्या करना चाहिए? डेफिनेटली आपको एक मेंटल हेल्थ प्रोफेशनल, एक साइकोलॉजिस्ट, साइकोथेरेपिस्ट या साइकियाट्रिस्ट को कंसल्ट करना चाहिए। फॉर व्हाट? टू प्रोवाइड एन एक्यूरेट डायग्नोसिस ऑफ ओसीडी और एनी अदर मेंटल हेल्थ कंडीशन। इसमें भी डिफरेंशियल डायग्नोसिस हो सकता है। या तो फिर एंग्जाइटी हो सकता है कुछ केसेस में, या तो कुछ केसेस में ऑब्सेसिव कंपल्सिव डिसऑर्डर हो सकता है। इसमें भी एक फिजिशियन को उसको डायग्नोस करना पड़ता है कि क्या है करके, बाय नोइंग द एक्सपीरियंसिंग डिस्ट्रेसिंग सिम्टम्स and appropriate treatment। OCD is a treatable condition, and early intervention can lead to better outcomes and improved quality of life। OCD is treatable condition। ये कोई इतना ये नहीं है, मतलब इम्पॉसिबल नहीं है इसको ट्रीट करना। इट इज क्वाइट पॉसिबल, इट इज क्वाइट ट्रीटेबल। सो एंड अर्ली इंटरवेंशन, जितना जल्दी आप उसमें इंटरवेंशन हो, एक फिजिशियन का, एक साइकोथेरेपिस्ट का, एक साइकियाट्रिस्ट का, उतनी जल्दी ही आपका क्वालिटी ऑफ लाइफ इंप्रूव होगा, और देयर बी बेटर आउटकम्स एंड इम्प्रूव क्वालिटी ऑफ लाइफ। सो व्हाट आर द डिफरेंट टाइप्स ऑफ ओसीडी, ये मैंने ब्रीफली डिस्कस किया है, यहाँ पे हम डिटेली डिस्कस करते हैं। डिफरेंट टाइप्स ऑफ ओसीडी आर कैरेक्टराइज्ड बाय स्पेसिफिक थीम्स और एरियाज ऑफ ऑब्सेशंस एंड कंपल्शन। इसमें एक पैटर्न होता है, एक थीम होता है, एक पैटर्न होता है। while there can be numerous subtypes, there contamination OCD, first one is, which is common, fear of contamination from germs, dirt, harmful substances। What they do is excessive hand washing, avoiding touching objects, excessive wearing of gloves, excessive bathing, excessive cleaning to and to prevent contamination। So this is one. Checking OCD, checking OCD also we have talked about। Checking OCD is fear of harm, either of the self harm, either of for the others। So what they do is they check it frequently, stove, doors, geyser, anything and everything। So fear of harm or negative consequence due to forgetting something important, obsession, this is the obsession। And what is the compulsion? Compulsion is repeatedly checking things to ensure that they are safe or turned off। Next is symmetry and order OCD। This is a kind of OCD। What a person does is, obsession is a strong need for things to be perfectly arranged or symmetrical। There is a strong urge in the mind, or need for things to be perfectly arranged। ऐसे ही रखना है मुझे, इसी तरह से symmetrically मुझे रखना है। And what is the compulsion? Rearranging or aligning the objects until they feel just right। Rearranging the wardrobe, rearranging the dining table, this consumes a lot of time because this becomes repeated। And next is intrusive thoughts OCD। So what is intrusive thoughts? Obsession में क्या होता है? Disturbing and unwanted thoughts or mental images about harm coming to oneself or others। This is also about the maybe about the harm। So disturbed and unwanted thoughts, like somebody is gonna kill me, this also might happen, or somebody is planning to kill me, somebody will put poison in my food and give me, somebody will poke a knife। So what he will do, because of this disorder, he might वो चाकू हमेशा छुपा के रख दे, या फिर खाना ही ना खाए दूसरे के हाथों का बनाया हुआ, क्योंकि कांस्टेंट उनके मन में फियर और एंजाइटी रहता है कि कोई मुझे मारना चाहता है। तो कंपल्शन क्या हो जाता है, हमेशा इधर प्रेइंग करते रह सकता है, इधर काउंटिंग करते रह सकता है, या फिर इधर खाना ही छोड़ सकता है, किसी के हाथ का अगर उसको फियर है उस पर्सन कुछ कर देगा करके, और बाहर जाना भी अवॉइड कर सकते हैं कि बाहर में नहीं निकलूंगा तो कोई मुझे मार देगा, दिस में ऑल्सो हैपन. So all these are intrusive thoughts. There might be sexual thoughts as well. And hoarding OCD. Hoarding में एक kind of OCD है. क्या है hoarding मतलब? Fear of losing. So obsession, इसमें obsession क्या होता है? Fear of losing important items. हमें जब चाहिए होता है शायद वो items हमें ना ही मिले future में. Hoarding is fear of losing. What they do is hoarding is collecting and saving excessive amounts. अगर महीने में if they require 10 kilos of rice, they bring 50 to 70 kilos of rice like that. And this is just an example, maybe a vague example, but collecting and saving excessive amounts of items or excessive amounts of clothes, excessive amounts of gadgets, excessive amounts of jewelry, excessive amounts of grocery, whatever it is, even if they have little or no practical value. So practically it might be completely irrational, that fear of losing or not getting the items in future, because those items will be back in the future. But what happens is, because of this obsession, fear of losing, or you will not have that item, frequent collecting and saving excessive amounts of them. मतलब जरूरत से कहीं ज्यादा चीजों को लाके उसका ढेर करना, होर्डिंग करना, उसको घर में रखना, या फिर गैजेट्स हो या ज्वेल्स हो या ग्रोसरी हो या थिंग चीजें हो, कुछ भी हो सकता है, किसी भी चीज का ओसीडी हो सकता है. And stages of OCD. So, what are the stages? Here also there are stages. How are the stages, classified? The severity of OCD can vary from mild to severe, and it can significantly impact a person's daily functioning and quality of life. The stages of severity are generally classified as mild OCD, moderate OCD, and severe OCD. उसके बाद भी एक है extreme OCD. So, mild OCD, what happens in mild OCD? The obsessions and compulsions may be time consuming but do not significantly interfere with daily life. क्या होता है इसमें, the obsessions and the compulsion are definitely time consuming, but still the person is able to carry out his daily routine. So the individual may experience some distress, but it does not cause significant impairment in work, school, or relationships. It does not cause significant impairment. So you can consider it as initial stage or mild OCD. And what is moderate OCD? Moderate OCD में क्या हो जाता है? Obsessions and compulsions are more time consuming and may start to interfere with daily activities and relationships. This becomes more time consuming and it may start to interfere with daily activities and relationships. The individual may feel increased anxiety. इसमें क्या होता है, थोड़ा बहुत डेली रूटीन इनमें इंटरफियर होता है. मतलब इतना टाइम कंज्यूमिंग हो जाता है कि शायद एक काम छूट जाए, बाकी का काम कर ले, ऐसा होता है. दीज आर द स्टेजेस, लाइक द इंडिविजुअल में फील इंक्रीज एंजाइटी एंड डिस्ट्रेस ड्यू टू ऑब्सेसिव थॉट्स एंड एंगेजिंग इन रिचुअल्स. सो क्या होता है, एक पर्सन, एग्जाम्पल पैरेट is checking OCD and spends about 1 to 2 hours each day checking locks, appliances, windows. Her friends and family have noticed her preoccupation and worry. ये क्या हो जाता है, इस स्टेज में फ्रेंड्स एंड फैमिली भी इसको नोटिस करने लग जाते हैं. पीपल अराउंड यू स्टार्ट नोटिसिंग दैट दिस पर्सन is overly doing it, over indulging his things. See, the key is ati sarvatra varjayet. Don't overindulge in anything. And severe OCD. So, see what a severe OCD is. Obsessions and compulsions are highly time consuming, taking up a significant portion of your individual's day. सो एक रूटीन में एक आधा दिन या 12 आवर्स और 13 आवर्स जो आपका वर्किंग पीरियड है या फिर जो प्रोडक्टिव टाइम है उसको कंज्यूम कर लेता है. द ऑब्सेशन एंड कंपल्शंस कंज्यूम योर सिग्निफिकेंट पोर्शन ऑफ द डे. So daily life is significantly impacted, and individual may struggle to maintain work, school or social functioning or personal relationships. इस सब में significant impact आता है. सो वर्क में, स्कूल में और सोशल फंक्शनिंग में, पर्सनल पर्सनल एंड प्रोफेशनल में बहुत ज़्यादा इम्पैक्ट आता है. सो व्हाट हैपेंस हियर इज एप्पल हैज अ सिमेट्री एंड ऑर्डर ओसीडी. सो इसको एप्पल को एक सिमेट्री डिसऑर्डर है कि ऐसे ही रखना है चीजों को, परफेक्टली ऐसे ही प्लेस करना है. एंड ही स्पेंड्स 5 to 6 hours ईच डे अरेंजिंग एंड रीअरेंजिंग ऑब्जेक्ट्स एट होम. ये 6 hours, 6 घंटे इसी में निकाल देता है एप्पल. तो क्या होता है, ही हैज लॉस्ट हिज जॉब. इस वजह से क्या है, टाइम पे जॉब पे नहीं जा पाता. ही हैज लॉस्ट हिज जॉब. पहले तो इसको इंटीमेशन देते हैं, फिर बाद में भी नहीं सुधरता तो इसका जॉब चले जाते हैं. तो इसके वजह से क्या होता है, इसका पर्सनल रिलेशनशिप भी इम्पैक्ट होने लगता है कुछ टाइम के बाद. और ये फ्रेंड्स से, फैमिली से कट ऑफ होने लगता है. और ये सब ना, ये उनके आसपास के लोग इसको ऑब्जर्व कर सकते हैं. So he has lost his job and isolated himself from the friends due to time he devotes to his rituals because of this. So it is severe OCD. So extreme OCD क्या होता है, this is very rare thing. Obsessions and compulsions are all encompassing, leaving little room for other activities or relationships. किसी के लिए भी टाइम नहीं रहता सुबह से रात सोने तक, या फिर और भी ज्यादा सिर्फ ऑब्सेशन एंड कंपल्शन. या तो फिर हाथ धोते रहना, या तो फिर नहाते रहना, या तो फिर क्लीन करते रहना. उसका प्रोडक्टिविटी जीरो हो जाता है, जीरो और नील. एंड रिलेशनशिप्स भी कुछ भी नहीं बचते. नो फ्रेंड्स, नो रिलेशनशिप्स, नो सोशल गैदरिंग्स, नो वर्क, नो स्कूल, नथिंग. The individual experiences severe distress and may have difficulty leaving their home or participating in normal daily tasks. So it is very difficult or impossible for him or her to participate in normal daily activities. So ये इसका example क्या है? Pigeon. Pigeon has a hoarding OCD and her home is filled with excessive amount of items, making it nearly impossible to navigate through the space. घर इतना भर जाता है चीजों से, क्योंकि वो चीजें होर्डिंग करके करके करके, एक डिनर सेट नहीं 10 डिनर सेट रखती है, इतने ज्वेलरी रखती है. फिर she does it for everything, anything and everything, because she has a fear in mind that she'll not get those items in future. सो क्या होता है, पिजन का ऑलमोस्ट घर ही पूरा ऑक्यूपाई हो जाता है. और घर ही नहीं, उसका टाइम भी पूरा ऑक्यूपाई हो जाता है, सिर्फ शॉपिंग में ही निकल जाता है पूरा, सुबह से रात तक फिर सिर्फ शॉपिंग और लेके आने में ही निकल जाता है. सो वो एम्प्लॉयमेंट को मैनेज नहीं कर पाती, कॉन्टैक्ट्स कट हो जाते हैं, प्रोफेशनल एंड पर्सनल कॉन्टैक्ट्स कट जाते हैं. शी इज अनेबल टू मेंटेन एम्प्लॉयमेंट एंड कट ऑफ कॉन्टैक्ट्स विद फ्रेंड्स एंड फैमिली. वर्क से, फैमिली से, फ्रेंड्स से, सबसे कॉन्टैक्ट कट हो जाता है. इट्स एसेंशियल टू रिमेंबर दैट OCD exists on a spectrum and individuals with any level of severity can benefit from seeking professional help. See, an ounce of prevention is better than pounds of cure. So, as soon as you recognize the signs and symptoms, please approach a mental health professional. Don't delay, because prevention is always better than cure. And see, and what is the exact cause of OCD? ये तो OCD तो बहुत सुन लिया. तो किस वजह से होता है ये OCD? See, the exact causes of OCD are not fully understood, but research suggests that it results from a combination of genetic, biological, environmental and psychological factors. सारे factors responsible है, जैसे कि genetic, हो सकता है, क्योंकि कोई सपोर्टिव एविडेंस नहीं है। बायोलॉजिकल फैक्टर्स हो सकते हैं, जो थे बढ़ते बढ़ते बचपन में कुछ देखा हो, कुछ इम्पैक्ट कर दिया हो। एनवायरमेंटल फैक्टर्स हो सकते हैं कि आसपास में कुछ ऐसा देखा हो जो उनके मन मन में बैठ गया हो। एंड साइकोलॉजिकल फैक्टर्स आर, मन में ही ऐसे घबराहट शुरू हो जाए विदाउट एनी रीजन। So, all these are there. Genetics says there is no evidence to suggest that OCD runs in families. ऐसा तो कहीं नहीं देखा है कि फैमिली में OCD रन करता है. But maybe if someone in a close family member has OCD, they might have a higher risk of developing the डिसऑर्डर देमसेल्व्स। कुछ बार क्या होता है, ब्रेन स्ट्रक्चर एंड केमिस्ट्री की वजह से भी होता है। abnormalities in certain neurotransmitters में सच एज सेरोटोनिन हुआ, सेरोटोनिन ट्रांसमिटर्स जो है उसमें abnormalities हो तो have been linked to OCD. Abnormalities in certain neurotransmitters such as serotonin have been linked to OCD. Serotonin plays a crucial role in regulating mood, anxiety and behavior. So, additionally, some studies have shown that there may be structural differences in the brains of individuals with OCD. हो सकता है कि ब्रेन स्ट्रक्चर में कुछ डिफरेंस हो, न्यूरोट्रांसमीटर्स में एबनॉर्मैलिटीज हो, लेकिन ये सब ऐसे प्रूवन नहीं है कि इसी वजह से होता है। हो सकता है कि ऐसा हो। एंड देर में बी एनवायरमेंटल फैक्टर्स, क्या ट्रॉमेटिक एंड स्ट्रेसफुल लाइफ इवेंट्स, बचपन में कभी ऐसा हुआ हो कि कहीं देखा हो कि जर्म्स के वजह से इन्फेक्शन फैल गया हो कहीं फैमिली में, फ्रेंड में, या तो फिर कुछ गैस के वजह से गैस एक्सप्लोजन देखा हो, या फिर ऐसा कुछ देखा हो सच एज अब्यूज, लॉस और सिग्निफिकेंट कुछ चेंज देखे हो, that will make the core belief, that will trigger the onset of OCD और एक core belief बना देता है in individuals who are genetically predisposed to the disorder. And cognitive factors, certain thinking patterns, ये psychological factor है। कुछ लोगों का थिंकिंग पैटर्न और कॉग्निटिव बायसेस क्या करता है ना, एक एग्जैजरेशन लेके आता है। Certain thinking patterns and cognitive biases, such as exaggerated sense of responsibility or a tendency to overestimate threats, can contribute to the development and maintenance of OCD. इसके वजह से भी हो सकता है डेवलपमेंट और मेंटेनेंस ओसीडी में, ये कंट्रीब्यूट कर सकते हैं कॉग्निटिव फैक्टर्स, द थिंकिंग पैटर्न्स एंड द कॉग्निटिव बायसेस। एंड व्हाट इज बिहेवियरल कंडीशनिंग? समटाइम्स व्हाट हैपेंस इज behavioral, there are repeatedly performing compulsive behaviors in response to obsessions can reinforce the link between two. दो तीन बार ऐसा होता है, नॉर्मल पीपल तो उसे डिसमिस कर लेते हैं, लेकिन कुछ लोग क्या करते हैं, उसको अडेप्ट कर लेते हैं। तो क्या होता है, एक हॉबी जैसा, एक हैबिट जैसा कभी कभी हो रहा हो, वो हमेशा होने लग जाता है। सो रिपीटेडली परफॉर्मिंग कंपल्सिव बिहेवियर्स इन रिस्पॉन्स टू ऑब्सेशंस कैन रीइंफोर्स द लिंक बिटवीन द टू, making the compulsions more automatic and difficult to control. So this is it in what we call it as, like we have discussed about the everything about it, but the management part and what happens to the mind and body, I'll discuss it in the next session because it is already an hour. So I think I'll discuss this in the next session, the management, the treatment part, how the psychotherapy helps, how the Ayurveda Sattva Vajaya Chikitsa helps, and how to prevent it, how to manage it. Everything will be discussed with the case studies in my next session on OCD. So that's it for today. Thank you for staying tuned, and let me know your thoughts in the comments section so that I get to know that how are you getting the concepts, and what do you think of it, what do you make of it. So, and thank you very much, and namaste.